If you're ready, I'm starting the timer and here is your question.
Yes, ma'am, I am ready, inshallah.
Sorry. Okay, yes. If you have read and understood,
Yes, ma'am.
considering
ma'am.
it, yes. Just a second, I have to
Yes,
start
I
the
will
timer
start by
again.
washing my hands.
Yes,
Good morning, ma'am.
yes.
I'm Dr. Ghazir, one of surgical doctors here. Can I confirm your name and age, please, ma'am?
I'm 44, Samantha.
Samantha. Nice to meet you, Samantha. Today, I'm going to examine your tummy. It will include the general look from the end of the bed, close look through your tummy, feel, tap and listen through your tummy, including also general examination of your head, neck, leg, and arm. Do you agree with this?
Yes.
Okay. Do you have any pain at the moment?
Not that much. Go ahead, please.
Yes. If you experience any pain, let me know and point at this area on examination. Okay.
Okay.
So, if you don't mind, we will examine your abdomen. Can you lie down on the couch, please, and
Okay.
take off your chair from the waist up, please,
Okay.
keeping with your bra and with sheet and exposing to the mid side. Okay. So
Yes.
I will take a look from the end of the bed. So if you don't mind, now can you lower your eyelid, please, for me, and at the same time look upward, please, looking for pallor and jaundice. Now, can you open your mouth and stick your tongue out? Then stick your tongue up, searching for any candidiasis or central cyanosis. Now, can you, if you don't mind, can you look to the left side, looking for any congested neck vein? So, do you have any shoulder pain, even right or left? So can you lift up your arms right and left, please, searching for acanthosis nigricans. And now I will take a look on your chest, please, for presence of any spider nevi. So can you put your hands in front of you? I will take close look. So for presence in any colonychia or any abnormality, can you put your finger in each other, on both each other, to detect a clubbing? And can you turn your hand over to detect any palmar erythema or Dupuytren contraction? Now I will feel the temperature of your hands from distal to proximal, and I will squeeze your finger to detect the capillary fill. So now, can you straight your hands and cock up your wrist, please, to detect any asterix? If you don't mind, now I will flat the bed, zero angle, for further abdominal examination. So can you hold your breath, please? I will detect any epigastric pulsation. Can you give me a cough to detect any apparent swelling? Can you lift off your hand from the bed to detect any divercation of recti? Now I will order for a chair. If not possible, I will kneel downward to make, I'm going to feel your tummy. If you experience any pain, let me know. I will, by flat of my hand, stretch it, feel light palpation of the 9 area. starting from right iliac, ending by right hypochondrium. Now, can you bend your knees, please? Now I will feel your tummy deeply, the same 9 area. And now I will go to feel your liver, and also detect any Murphy sign after asking the patient to take a deep breath in and out, and move my finger at the expiration, and let my finger detect the lower edge of the liver, detecting the pattern border and so on, and detect Murphy sign at the 9 costal cartilage below the costal margin. Now also I will feel the spleen from right iliac fossa toward the left hypochondrium 1. Also aortic pulsation, and by manual examination, ballotment for renal pathology, even right or left. Then now I will tap through your chest to detect the upper border of the liver after detecting the lower border of right and left lobe from above the umbilicus. And also detect the upper border of the spleen, 9 and 10 and 11 percussion by counting from the sternal angle. And now also I will tap through your tummy, infra-umbilical, to detect any suprapubic fullness for full bladder. Now I will also tap to detect any ascites toward the right side of the abdomen. Then we'll ask the patient to lean to the other side, turn to the other side, wait 30 seconds to detect any ascitic fluid. So and also tap again to detect any resistance after dullness. Also, I will, if I detect any organomegaly, I will tap to detect any dullness of the lower border of the liver or the spleen, and palpate also for any swelling as hernia and so on. And if present, I will comment on C size, CS, and defect. I will listen through your abdomen, your tummy, I'm sorry. Listen for intestinal sound and any beroid, just supra-umbilical at the site of palpation, feeling of aortic pulsation, and 2 centimeter lateral and above 2 umbilicus for any renal beroid by the cone. So now I will press through your leg to detect any lower abdominal edema. So,
Can you please present your case now?
So I will offer cervical lymph nodes, Virchow lymph node examination. Take your, can you dress now? I will wash my hands. Today I examined Miss Smith, 45 years old, who presented complaining of pain in the right hypochondrium on examination. General look, there is no positive finding on abdominal examination. There is a positive Murphy sign with tenderness in the right hypochondrium. Otherwise normal. So my to complete my examination, I will do examination of the external genitalia, other hernial orifices, and the digital rectal examination if possible. So my top differential diagnosis will be acute cholecystitis.
Very good.
But I will consider the other causes of the same complaint in form of ascending cholangitis, acute pancreatitis, lower lobe pneumonia, also renal pathology for ureteric correct.
How would you confirm your diagnosis? What investigations would you ask for?
I will order some lab investigation form of full blood count, CRP, urea electrolyte liver function. But I will also, the most important is ultrasound abdomen pelvis to detect any gallbladder stones or cholecystitis signs. If I detected any CBD stones or intrahepatic biliary radical dilatation, I will consider to order MRCP, magnetic resonance cholangiopancreatography, to detect the anatomy and the site of the obstruction.
What are the treatment options you can offer to this patient, considering she's obese and she's a female?
Yes, considering that I will start by conservative management in form of nil per mouse, nothing per mouse, nasogastric tube suction, and order IV fluid, antibiotic in form of metronidazole and third generation cephalosporin. If the patient deteriorated of no response within 48 hours to 3 days, I will offer the patient surgical treatment within the first.
Very good. Very good. Thank you so much.
Thank you, ma'am.
Thank you. Yes, anyone want to give feedback? I think he covered everything. I was kind of following him and he covered everything. He did it very well and he even did the diagnosis very well. with justified reasonings and yeah. Anyone else want to add anything? No, thank you.
Wait, okay.
Started the timer. Now you will get to read the question. So if you have read and understood, considering it communication skills station, kindly begin.
Yes. Hello, Mr. Zafar. I am Dr. Al-Ghazir, Mr. Ghazir, one of surgical doctors in this department. I have been told that you are having some concern regarding stopping your warfarin pills before doing your operation. So if you don't mind, can you tell me more about your concern regarding this, please?
Actually, I have a prosthetic heart replacement, and my doctor prescribed the warfarin, and he said, "Don't stop that because there's so danger to develop some clots in my heart, and this is serious."
Yeah, yeah. So I do appreciate your concern, but if you don't mind, let me explain why you are prescribed warfarin and what is the warfarin and what are substitutes and what we are going to arrange for your safety. So let me explain that. Firstly, warfarin is the medication that prevent production of some chemicals that has a blood thinning effect. It's usually used for many patients, as like your case, to prevent and treat formation of blood clots, as your case in artificial valve. But in your case, the issue we are going to operate open you. So it will be there is a risk for ongoing bleeding just during or after the operation. So the other issue that the warfarin has a long duration of action for about 5 days. So we have to stop this medication before the operation about 5 days ago. So we will not put you unsafe without blood thinning effect of warfarin. So the aim for our plan is that to replace warfarin with another one injectable that is called heparin, but with a short duration of action. So we will be able to stop it just 12 hours before your operation. So how does that sound, Mr. Zafar?
Is this due by you or under supervision by you?
So that's a good question. In this case, we are usually arrange with each other as a team, including our consultant firstly, and the anesthetist consultant, anesthesia consultant for preoperative optimization. But we also should consider involvement local policy of the hospital, including hematologist, as this arrangement is critical before any operation. So we don't take the decision by single person, but including multidisciplinary team. How does that sound, Mr. Zafar?
It's good. I have a question. When
Yeah.
can I assume that warfarin? Because it is, as you know, it is so important for my condition. I cannot stay on the heparin.
So you ask to make sure that about your question that you ask about you will continue on heparin or will regain warfarin. Is that right or not?
Yes, my query about when I can reassume warfarin because it's so important. I cannot stay on the injection of heparin.
Yes. So that's a good question. As I mentioned, that's the difference in the long duration of action. But this question I can answer in form of that after operation, and we are sure about there is no ongoing or possibility of ongoing bleeding, we will start also resume heparin after operation. And when oral feeding is tolerated, we will start warfarin. And when we are sure about that the blood thinning effect of warfarin regained by ordering some blood investigation, we will stop the injectable heparin and we resume with warfarin. This will managed after stopping preoperatively warfarin 5 days before the operation and start injectable one, which is heparin, and will be stopped 12 hours before operation. Is that clear, Mr. Jaffer, or any issue?
Yeah, it's clear. But did you admit me or I can do it in the home?
Yes, that's important thing. As regard your safety, we will consider that we will admit you in the hospital at least 5 days before the operation. So we will start to stop warfarin and replace it or substitute with the injectable one, which is heparin. As from our point of view and according to your case, it will be difficult and risky to inject yourself, as artificial valve is a risk for thromboembolism. And as regard your case notes, we will find the difficulty to inject yourself. So is that clear?
So you admit me?
Yes, you will need to be admitted 5 days before operation.
So what about my drugs for anxiety? I take medication for anxiety for a long time. Can I take it before operation or I couldn't?
Yes, I am really sorry for this issue according to the anxiety, but it usually a common conditions before all patients. So as regard your bills of anxiety, you will be allowed to take your medication just at the morning of the operation day, but just with small sips of water to avoid overfilling of your food reservoir, which we call a stomach. So it will be allowed. Is that clear for this matter or not yet?
Yeah, it's now clear for me. Thank you very much.
Yes. So now, do you have any concern regarding this matter or get it all information?
No, it's fine. Until now, it's fine. If I have a question, can I ask you?
Yes, at any time, but to make sure that you got all information right, as I mentioned, let us to recap what we have mentioned. You have a concern regarding stopping your warfarin bills. We will stop it 5 days before operation, after admission of you. So we will be released by injectable heparin. We will be injected subcutaneous, including our MDT team, and we will order some blood investigation to make sure the blood thinning effect is acting. You will resume heparin after operation, replacing it with the warfarin. and then stop heparin, regain the blood thinning effect of your warfarin. Okay, do you have any question?
No, thank you very much.
Thank you for your attention. Thank you. Okay.
Thank you. All right. Yes, Dr. Dafa, would you give feedback first?
I will give some. I appreciate this is greatly thanks for Dr. Mohammed. He presented the case very well,
Yes.
but he should know the looking for the time. He repeated the schedule of the warfarin 3 times. We how to stop the warfarin, how to
Yes, he wasn't sure if you're getting it or not.
Yeah.
If there would be a real patient, patient will be responding. So he will get the signal that his message is getting across.
Yeah. So we take long time. So we may ask many questions, but if you shortening the time, this patient asking about sometime about his anxiety because he's feeling alone.
Yes, that question is right. You had to mention that since I'm living alone, how would that go? Then he would have suggested himself that he would suggested that we will admit you because since you're living it alone and we'll make it easy for you. But then you asked him if you will be admitting me, so he handled that question very well. One question that you asked in this scenario or in this station, there was no question that if you will be operating on me yourself. It was like more kind of reassuring one, like patient had consultant, the examiner or the candidate had to confirm which surgery you're going for and if you're aware, and then how much you know about the operation and why you are having it and etc. Because it was recurrent hernia. So that's why.
I did the station exactly how I find it in the exam.
Yes.
The patient is about 60 years old. He's cut the steak on the black glasses.
Yes, blind.
Yeah.
Yes.
Yeah, and he's not looking for you, looking for other side.
Yes.
And he's looking fear, anxiety, unstable, irritable. Yeah. Well done.
Good, Dr. Mohammed. It was very good. Second time you've done it, and I'm really sure that by the end of this month, before your exam, you'll be expert. So you knew your station very well, and provided it was exam today, you would have done very well. So well done from me.
Thank you. Thanks, ma'am.
Good.